Yeah, good evening, everyone. I take this opportunity to welcome all of you on behalf of Wockhardt Pharmaceuticals for this very interesting topic. So, people have been talking about multiple problems, but the problem what today we are going to discuss is relevant to all of us. How, as a healthcare workers, the stress what we have faced in the last 4 to 5 months, I think we would not have experienced this kind of stress in our complete careers, and the impact it is going to have on our mental health is again becoming very relevant. So COVID has completely changed things upside down. The way we used to practice, the way we used to deal with patients, our work-life balance, everything has completely become upside down. And this topic has gained significant importance in today's world. So I welcome all of you, and we are really thankful to the esteemed faculty members who have joined us today. With us, we have Dr. Sunil Mittal sir, and Dr. Kler has not been able to join today because of an urgent procedure he is stuck in. So we expect if he is able to finish his procedure in time, he'll be able to join us. And then we have Dr. Anoop Gogia sir with us and Ms. Mitali Srivastava. So, with this expert panel, we are going to discuss and debate upon the pandemic's challenge, emotional PPE and healing workplace scars. And first, I would like to introduce and welcome our first speaker, Dr. Sunil Mittal, sir. Sir is Director, Cosmos Institute of Mental Health and Behavioral Sciences, New Delhi, and Director of Asia Pacific World Federation of Mental Health. Sir has an extreme experience of around 30 years, clinical as well as teaching experience, and he has worked at PGI Chandigarh and Lady Hardinge Medical College, and he has been a consultant psychiatrist in practice since last 27 years. He has published almost 30 review and research articles and has conducted more than 250 lectures and workshops. He continues to remain active in the media, contributing to articles in newspaper and magazines and featuring in radio and television channels very frequently. So we welcome you, sir, on behalf of Wockhardt, and we are really thankful that you are able to spare your precious time today and enlighten all of us on this important topic.
Thank you. Thank you.
Dr. Kler has not been able to join us today, but I think he's a well-known cardiologist and everyone knows him well. He's an Padam Bhushan awardee, and he's a chairman of Pushpavati Singhania Heart Institute, Delhi. And once sir comes, we can again try to establish connect with him. And then we have Dr. Anoop Raj Gogia. Sir is professor and consultant, ex-head of the department, ICU in charge, and coordinator of Corona unit at Safdarjung Hospital, New Delhi. And sir was ex-HOD anesthesia at Safdarjung Hospital and ICU in charge and coordinator of Corona unit at Safdarjung Hospital. He's a secretary, Acupuncture Association of India, Delhi branch, founder member ICA, and past president of Delhi ISA. And his areas of interest are pain relief and trauma care. We welcome you, sir, and thank you for joining us today.
Thank you so much.
And we have clinical psychologist, Ms. Mitali Srivastava. She's head Department of Clinical Psychology at CIMBS New Delhi. And clinical hypnotherapist and NLP master practitioner and MBCT therapist. She has more than 16 years of clinical experience and associated with CIMBS for more than 13 years now. And she was winner of Award of Excellence in Holistic Healing Science from IBM. I think we are really keen to look forward from a clinical psychologist perspective that what is the kind of damage this situation is causing to healthcare workers and how do we cope up with this in the current situation. So we welcome you, Ms. Mitali, for the session today.
You're on mute. You have to unmute.
Thank you, sir.
So now, without delay, I will request Dr. Mittal to give his talk on mental health and how do we cope during COVID-19. Over to you, Dr. Mittal, sir.
Thank you, Dr. Ish. As you mentioned rightly so that today evening we are discussing a very important topic because what's been said is after the pandemic, COVID-19 pandemic, there is likely to be a mental health pandemic. As it is, it has been felt that the mental health conditions are very prevalent, much more prevalent than ever thought of. In fact, the President of India, uh, Shri Kovind, had in 2017, while inaugurating the World Federation for Mental Health World Congress in Delhi, which we had organized, by inaugurating that, he had said that there is an epidemic of mental health problems in our country, and our resources are limited. So we need to really gear up to be able to meet up to that challenge. And over here, we are not now. The irony is this, that while the health workers were in the forefront of dealing with this pandemic and the COVID-19, the critical care, the other patients, the surveillance, the whole service being provided for COVID-19, they are at the front line, and they are really traumatized, and they're going through an extreme stressful experience, like you said, we have probably never experienced in our lifetime. And hopefully generations future down also don't need to experience such a trauma. And that has brought up the whole issue of coping, of psychological resilience, of being able to, while you're taking care of critically ill patients, being able to take care of your own mental health and take care of your own self. Mind and body, of course, are just artificial divisions. And if you're not happy in the mind, if you're not mentally well, your immunity is impacted. And then, of course, then that opens a door for more infection. And vice versa too. You get infected and your mental health goes for a toss. So mental health of healthcare workers is in focus worldwide. And that's actually, at the moment, it's a hidden COVID-19 crisis. It's gradually emerging. And as we see, as the pandemic wave is going to, the tsunami is going to recede, it's going to leave behind a lot of trauma in the general population, the scarring, morbidity, and we have seen morbidity in people who have been affected by COVID-19 in terms of neurological morbidity, pulmonary morbidity, or even vascular morbidity, dermatological morbidity, and then hugely psychiatric morbidity, whether it's anxiety, depression, psychosis, or other neuropsychiatric conditions, or the whole question of one's existence that one is faced with. So when we look at healthcare workers, so so it's rightly said that all of us under this squeeze, we understand is that difficult times reveals one's character. One's character is only shown once one is under the, the one is being pressed. And of course, like I said, that the more pressure, the more you can shine like a diamond. So the character is revealed. One can also crumble. And it's not in terms of just physiological and physical bodily immunity. It is also in terms of psychological immunity. That's why today in the discussion, we're going to talk about this psychological, emotional PPE, the emotional kavach or the emotional shield each one of us must have intact to be able to survive this pandemic and emerge on the other side, if I can use a lay term, sane and healthy. And greatness in any crisis lies in acceptance and working through it. Greatness is in any crisis lies in acceptance. Like you said, the crisis can only have two results. It can either dismember you, it can either crush you, or one can emerge stronger. And anything that doesn't kill me only makes me stronger. Well, yes, if it kills one, so be it. There's nothing more one can do. And then, of course, this is dedicated today to all frontline fighters untiringly working to save lives, despite severe stress, severe shortages of equipment, abysmally long working hours, personal risk of infection, and the infection they may carry back to their families, aged parents or children, and also to those who have lost or sacrificed their lives, which and their names remain unknown, saving lives of others in this pandemic. If I may have the next slide, please. So psychological times, like I'm mentioning, is in crises like this, it's like a wrestling match. So here coronavirus is throwing stressors at you. And then of course, the question is whether one's own coping mechanisms, I'm using terms just for understanding, are strong enough to overcome it. That means resilience, being a flexibility, the psychological ability to bounce back. And then of course, it's that grappling with the situation. And that's what it's come about. And we also know this, any pandemic, any crisis creates an existential anxiety. It wholly brings up the whole question of life, things we have never thought about, we never pause. And since we start thinking about it, there is a physiological response to the pandemic in terms of psychophysiological response. It alters and reprograms our nervous system, changing the way one sees and perceives threat, experiences everyday situations. Let me take an example. If you have been in lockdown, you've probably been at home trying to make the best of what is available to you in terms of whether it's food or entertainment resources or it's reading material, whatever you do. And therefore you discover some inner strengths. At the same time, this threat perception has undergone a change. Things you took for granted, I took for granted, are suddenly threatening. Meeting people, shaking hands, hugging people, public places, they become threatening. So therefore there is this whole threat perception that is changed. Next one, please. If I may have the next slide, yes. So just to recap, what is the coronavirus? It's an RNA virus. It's distributed among human, mammals, bats, and birds. Other creatures. It causes respiratory, enteric, hepatic, and neurological disorders. The different strains like alpha, beta, gamma, delta, and the first two are known to cause diseases in humans. And in the past, and there is a whole family of coronaviruses which we probably have been exposed to. And in the past, the severe acute respiratory syndrome, SARS-CoV as it was called, now SARS-1, and the Middle East respiratory syndrome, the MERS-CoV, both were zoonotic in origin. The current one, of course, we believe is zoonotic in origin, COVID-19. There is whole controversy whether it came from a lab, whether it came from the open, the wild meat market, whether it came from elsewhere. The conspiracy theories, we're not going there. Yes, we know this, the coronaviruses exist in other animals too. The catch is that it's got high prevalence, wide distribution, large genetic diversity, and frequent recombination of their genomes. As we have already heard, that probably some of the viruses have undergone a change. As the Hong Kong University reported, the second infection in a patient who had already recovered from COVID-19, and they believe it's a sort of mutant or a different strain of the virus. And of course, we know this, as the nature is under, the animal habitat is under pressure, there is increasing human-animal interface and activities. With a globalized world, travel is more, so epidemics soon become pandemics. They can actually spread fast. So if you look at the Indian figures as of today, these are figures from today. Current figures, just a couple of hours ago. So the number of cases reported in India are about 34.5 lakhs, 3.46 million, out of which almost 2/3, 26.5 lakh have recovered. And there are close to 62,000 deaths. Now the deaths are the ones that bother us. That's the one where we can talk in terms of the crude death rate, we can talk in terms of other death rates, we can talk in terms of death per capita. There are various ways to look at the statistics, but the real fact is 62,000 people have lost their lives, which can be attributed to COVID-19 directly or indirectly. And yes, there is also the controversy that probably more people may have died because of COVID. Who knows? They have not been reported. Top of the charts here is Maharashtra topping, and then of course the other states. The Delhi was somewhere up there, but it's gradually has come down. And as Dr. Gogia will share later the experience since he set up the COVID-19 unit in the Saptarang Hospital and the Medical College, and he runs it, he will share his experience of the changing trends that has been seen. So this is the Indian statistics. Regarding healthcare workers, again, this is the latest from India. 87,000 health staff have been known to be infected with COVID-19. 573 have died. And almost 3/4 of these cases are from 6 states. So this is the figure. So one may say that if it's 600 out of say 100,000 patients or 700 out of 100,000 staff infected, actually is less than 1% people dying in terms of medical staff dying but that's not the question. The question is catching the infection. The question that bothers every doctor is, will I get it? The question that bothers each one of us is, what happens if I get it, if I've got a comorbid condition or age, like for me, is against me? Or what happens in case I get it and I'm left with some serious morbidity. So those are the questions that bother all doctors. Next one, please. We are looking for a vaccine. So far, like I've often said, the only vaccine which is available for COVID-19 is behavioral vaccine. Change your behavior towards the disease. Whether it's a physical distancing, I don't like the term social distancing because we are socially connected right now. We are so connected. So social distance aside is more physical distance of 2 meters, wear the mask, sanitize and wash your hands more frequently. One doesn't need to go into panic mode. One doesn't need to go into a obsessive compulsive cleaning mode. And people are talking about when the vaccine is going to be here, we don't know. This is the current statistics as of 25th of August, as updated by WHO. There are 139 or more candidate vaccines of close to 150. And phase 1, 25, phase 2, 15, and phase 3, only 7 at the moment, and none has been approved. Of course, people are saying we might get in September, October, November, who knows where, and what is the safety. So vaccine aside, if there is a reinfection like has been reported from Hong Kong, or if the coronavirus, like other viruses, can actually mutate rapidly, we don't know. Just like for the flu, the vaccines may be required every year or every few years to be updated. Next one, please. So viral update, like we have for our computers, we are going to require for ourselves. And viruses challenge our immune systems, produce a lot of changes in our body, and they sort of rule us. But coronavirus is not just threatening our physical health, but our mental health too. They're not just a medical phenomenon. They affect individuals, they affect society. They affect economies, like we have seen. The economy, the health minister just announced that the economy is going to contract. Of course, there's a lot of controversy. Since when did it start contracting? That aside, the world economy has contracted. We have had huge, the pitiable, tragic, the amount of the workers, casual workers, daily workers, the factory workers who had to trek home. A lot of them lost their lives on the way, and probably they carried infections back home. While the pandemic is going to run its course through the entire population, from metros to other cities to smaller towns to villages, it is going to run its course. The virus is not going to go away. So people are going to develop immunity, and of course we talk in terms of herd immunity, or 60% population, 70% population. Well, let's hope so it happens. So, but what has been seen is, this was a report that the sale of anti-anxiety drugs shot up during the lockdown period, which is an indication of what was happening. So an increase was only not just for patients who were already suffering from mental disorders, but also for people who were fresh, like we saw in our practices. We have been practicing online from day one, and we saw an increase in people who were anxious, obsessive because of COVID. And we'll share later, we have also had calls from healthcare workers, nurses, doctors, paramedics, who were working in COVID environment, or who were not working in COVID environment, but were anxious that they may be exposed because their patients might bring it in. And many patients have attended various hospitals because of anxiety symptoms. Next slide, please. So what causes this anxiety? Of course, it is the anxiety of the uncertain and the peril to one's existence. All of us want life to be in a certain manner. We want predictability in life. The moment there's uncertainty, there is a problem. I often ask this question, what is fear? So if you say you're sleeping at night and there's a noise in your house, and you wake up and you try to make sense of the noise, and then you say, oh, it's probably a cat, or it's just the wind. But if you can't understand what that noise is, then one is pretty frightened. And you want to get up and to investigate, and one may be very scared. So uncertainty. And we don't know about this virus. We don't have any treatments. We don't know how it spreads. We don't know how it gets infected. We know for salmonella, infections, you can boil, you can, sterilize, but we don't know what sort of boiling sterilization works here. New reports have come in. Therefore, the uncertainty and the perils to one's existence, not just one to living, but existence as it is, one's comfort zone, as you and I exist. There's a peril, there's a threat. So that causes anxiety. Next one, please. And of course, this is from different studies. We have put it together for doctors, other health workers, the fear of infection, fear of own death, fear colleagues' infection and or death, my co-workers, my colleagues. Then there are reports of people seeing people with severe morbidity, in your OPDs, in the influenza-like illness OPDs, fever OPDs, people coming with severe morbidity, not just fever, but some of them, that is. Then people who work in COVID-19 units, high mortality all around from all across the world. That was the report, that they're seeing people dying. They're trying their best, but they're seeing people die. They don't know who's going to die. The tough task of updating families about the progress of a patient, because the families are not allowed to meet. Receiving and breaking bad news. No socializing to recharge and refresh, because in the early phase, now, people who may be in COVID-19 are in isolation or quarantine. The people who are working there. So they were put into quarantine. They may not carry back infection. So isolation, no socializing, fear of risk to family, carrying back infection to family members, infants. I've recently been talking to a doctor who was nursing a baby but worked in a COVID unit, and the flight she went through. So fear of risk to family, and all leading to burnout. So these are some of the factors we have culled together. In fact, we carried through a survey which you may have received on the email. We'll share the results later, looking at these factors. Next one, please. So common emotional and behavioral reactions that have been reported for healthcare workers are high anxiety, magnitude of ill-equipped working environment, shortage of PPE, anxiety about individual role, competence, training, which I'm sure Dr. Gogia can enlighten us about, concerns about infecting family members, burnout, shortages of ventilators, other critical care equipment, secondary traumatic stress, secondary to loss, etc. Lack of adequate precaution because of altruistic zeal, like we have seen some people going out of the way to have very kind, very important social altruistic work, but getting infected in the process, and some of them having died. And limited access to mental health services for managing healthcare workers' own depression, anxiety, and psychological distress. There is the stigma of approaching a mental health professional. We'll see that. And of course, mental health professionals are not available everywhere. So next one, please. The frontline healthcare workers have had reported having excessive workload, isolation, discrimination, physical exhaustion, fear, emotional and sleep problems. And recent study, which you can find the citation below, about 1,500 plus health professionals, 50.7 had depressive symptoms, 44 or more percentage had anxiety, and almost 36% had sleep disturbance. People who are working. Next one, please. And this is another one, which is for more than 1,200 healthcare workers, almost the same figures. Depression 50%, anxiety 44%, insomnia 34%, distress almost 72%. So this is what people have felt. And then of course they have had very little resource to actually go back to and to find support from. Next one, please. So we have looked at the Indian infections, but if you look at infections from elsewhere, more than 50,000 have been infected in Spain. They needed quarantine, and 10% of them had been hospitalized for COVID-19. Italy, more than 10,000 healthcare professionals between March and April itself. I don't have the latest figure from Italy but this is from a publication. So India is doing at 84,000. Given our large population, that's not that bad. But of course, it can still be prevented, and we need to bring it down. Next one, please. If I may have the next slide, yes. So on the mental problems, this was the survey by the British Medical Association of nearly 8,000 doctors, 7,821 medical doctors. And more than 40%, a little over 40% reported suffering from mental health issues. And 29% felt their already existing mental health problems got worse during the pandemic. So people who had it already got worse, and there were people almost 40%. So in your doctor colleagues who are working in COVID-19 units, 4 out of 10, 2 out of 5 probably are having some sort of mental health problem coping with the COVID-19 pandemic. Next one, please. If I may have the next slide, please. So rising number of cases, the rising mental health problem. This is just a graphical representation from month 1 to month 4. Insomnia, emotional exhaustion, anxiety, and depression. Next one, please. So as the case number rises, period of the pandemic gets prolonged, the morbidity, mental health morbidity also increases. Higher exposure was among in hospitals, support ambulance service, primary care personnel. These were the highest exposed. Studies from across the world have also shown that mental health facilities in the US, in Europe, they had a high rate of COVID-19 infection because they were closed facilities. Such figures at Delhi, I know that IBAS was one of the first centers in the country that set up a separate COVID-19 ward for people who may have mental illness, which was something amazing and which was something that should be replicated across the country. That all psychiatric units may have a unit, should have a unit where people who have COVID-19 positive and have psychiatric problem can be hospitalized. Next one, please. Can you have the next slide? Kapil?
So can you see the
so
slide?
If you look at demographics,
Yeah.
I can see the slides. If you look at the demographics of healthcare workers battling the pandemic, women are having an increased risk because of multiple roles that they have. Probably they get lesser support, and of course here women will also include a large number of paramedics and nursing staff. The younger healthcare professionals are more afraid of the virus being contagious, that means getting the virus. Older healthcare professionals were more worried about their death. The middle-aged were more, distressed. So this is what we found. So they were sort of more protected, but they were still distressed, but not the death, not the fear, but they were the ones who were, and they probably make a large chunk of the workforce. Next one, please. So of course, personality traits were some neuroticism, anxiety, pre-existing, previous mental disorders, loneliness, some physical complaints. So pre-existing anxious people, anxiety-prone people, people who are lonely, who don't have a good social network of support, or who had some what we refer to as neurotic tendencies, which a lot of us have, and or had other physical complaints, or more likely to have anxiety and depression. These were just findings from some of the studies. Next one, please. So what happens if you look at the stages? Stage 1 is the negative emotions. If you look at all, this is a study from a small bit of, sample of nurses, 1 week duration. Stage 1 was the first for negative emotion. As work increased, 50% felt anxious because you were still getting used to it. Like anything, any one of us, something new, you're anxious. Stage 2, coping and self-care. Then you learned how to cope. Then you began looking after yourself. And most of them felt that sleep was the best way to bust the stress. Sleep is the best way to decrease stress. 70% chose to adjust their sleep. Stage 3 was, internal growth occurs, like I mentioned at the beginning, under pressure. So you get motivated to contain the pandemic. You have that zeal, and then you realize, okay, yeah, you can do it. So the motivation builds up. The first is the anxiety, then you feel pressured, then you start coping, and then you grow under pressure. And then towards the end, positive emotions start emerging because you're succeeding, and you also feel that you're happy because you're able to contribute meaningfully. You're able to save people's lives. Hey, and suddenly the things are not that bad. People can even manage at home. The most serious ones also, they're surviving and they're going home. So positive emotions start developing. So these are the sort of 4 stages each one of us goes through. Initially is negative approach and being forced into this care. Second is coping and self-care. You start coping, resilience kicks in, you grow inside, and then one experiences positive emotions that you can overcome the challenge. Next one, please. If I may have the next slide, please. So these are the testimonials of negative emotions. I've worked so long and I'm standing, I have pain all over my body. Even if I put on protective clothing, I don't get time to eat, drink waters. I have to use actual diapers because I can't go to the toilet. These are actual reports. Although I volunteered to work in the Department of Infectious Diseases, I feel scared now. It's a new infection. There are no specific drugs. What do? I feel anxious. So fatigue, discomfort, fear, all these were the first few negative emotions fear, discomfort, anxiety, fatigue. Next one, please. If I may have the next slide, please.
So, Priya.
So these are just the same way. From China, the early reports, understandably, that's where it broke. We have gone through the figures. From India, this is from one of the startups. I'm mentioning this because this startup began reaching out to, it was a mental health startup which started reaching out to people. And this was in the early part of the pandemic. At Delhi, we have had experience, the Delhi IVAS again and the Delhi Psychiatric Society. We set up a line, some of us volunteered, including me, and we were on call for health professionals, healthcare workers who may have difficulty and problems during the COVID-19 by looking after patients. So, and the responses were there, people were managed, calls came in, and yes, people are able to cope, they're able to manage their lives, and they're able to face the challenge which is there. Ultimately, it's our task and we need to do it. So next one, please. The similar report from Canada, 14% of healthcare workers reported a need for psychological support. From Pakistan, also our neighbor had reported moderate to severe psychological distress. So you have, it's across the world. It's not nothing which is specific to our country or to Europe or to America or to China. It's across the world. Human beings are human beings. We respond the same way. Next one, please. So these are the, again, symptom checklists, the insomnia, anxiety, depression, somatization, and the other one is obsessive compulsive symptoms of hand washing, of cleanliness, of fear of infection. So that's the other symptom group which is seen. Next one, please. If I may have the next slide, please.
Yeah, sir.
We can skip this one. These are all the studies for reference for anybody who would like to have them. This can these can be sent across. Next one. So real life stories from India. These are just recounting. I'll just look at the taglines. Somebody felt so severe that she couldn't hug her own children who wanted, very young children who wanted to be hugged. Some internal medicine senior consultant. From Assam, there was the general surgeon who said, I can't talk to my parents. And then he spoke to his parents who lived 2,000 kilometers again in Itawa. Since he had tested positive on June 25th, he didn't want to talk to his family because he didn't want to worry them. He didn't want to share with anybody. He didn't want to, so the news may not go back to his family. So he's keeping it inside, and that takes its own toll. A stigma, we have known about doctors being expelled for the residential societies, or, some have been beaten. So the nurse, who doesn't want to reveal her identity, says that she feels anxious because she doesn't know if the person she is actually examining or speaking to is COVID positive or negative. So that creates a lot of anxiety. So these are real life and the stigma that she carries. Next one, please. What do we do? So WHO has outlined a policy to battle mental health problems. So they say that a policy document is required, which we should put together. The government has put together something. The government has actually said that counseling services should be available not just to doctors and healthcare workers, but of course they said even to the migrant laborers, and that counseling should be there, psychological first aid should be provided. So this benefits both patients and doctors. And here there is the main role is of government and media. That's step one. And then the step two is access to remote support, which needs to be scaled up. Online consultation, telephonic consultations, because face-to-face consultation, as it is in pandemic, is not possible. Travel is restricted, and technology can be best used. Like we are doing a remote, webinar at the moment, remote conference at the moment. And then the other thing was that a system needs to be put in place for doctors. This is the WHO. Next slide, please. Kapil, yeah. So they said that the measures that need to be, I can see the slide. The measures that are required, when the last was measures for healthcare workers, what is required is social support and coping strategies to healthcare workers and enabling them to communicate. So allowing them to communicate, talk about their anxieties amongst each other, having some people they can speak with. They can be volunteer counselors they can speak with. They can actually open up their hearts rather than keeping it bottled because they don't want to go back and talk about all the morbidity and their own anxieties to their family because the family will start worrying, or they don't want to disclose to even their colleagues. Sometimes they don't want to disclose their inner insecurities or that they are feeling incompetent to handle. Therefore, so some support is required. And then healthcare workers also require training to handle disasters, epidemics, and pandemics. We have been caught off guard. The government and other people have not really invested into health. Investment into mental health is abysmal, and not to say, there's nothing there. And then, of course, training for there was no preparedness for this handling such an pandemic. Then adequate resources to prevent moral injury, unnecessary deaths, create staffing procedures and schedules. And it's very pitiable when people feel stressed, they get depressed, or there is absenteeism, they don't report for duties, and they can be hauled up for that, or they resort to suicide, like we have seen. People, doctors who have been exposed to COVID-19, there are reports of doctors or other healthcare professionals having committed suicide or attempted suicide, which is an extreme step and very, very tragic, which is preventable. Next one, please. So offering psychosocial support to staff. So every hospital should have a system for psychosocial support to staff. This is one of the, this is the American Medical Association recommendation. So monitor and review staff member well-being, review it. Team leaders have to review it. Creating an environment for communication, talking about what their difficulties they have, even that mitigates their anxiety. Discuss emerging issues and adequate response to their needs. Next one, please. So these are the systems that require to be set up. We know these mental illnesses are on the increase, and during the pandemic, they will increase further. Next one, please. This has been well said by a professor of psychiatry at Berkeley. Taking care of ourselves is not a selfish act. Actually, it is a sign of strength. It's not a sign of weakness to seek emotional support. So seeking support is a sign of strength, not of weakness. Looking after our own selves is not a selfish act. I can only give you what I have. If I don't have wellness inside, I can't give you wellness. So take care of yourself, each one of us. And then, of course, communicate, talk, share, seek emotional support. We are all aware of the longest study in Harvard, which has been done for over 70 years. Who are happy, and the 70 years the study is followed up. 2 or 3 of them have become presidents of the US. They have been eminent lawyers, other sportsmen, artists. Some have been criminals too. And then, of course, the common factor they found that it was not the money they earned. The billionaires have also come out from that 70 years of study. The common factor was social connectedness and how much of network of support people had. Even if you have 2, 3, 4, 5 good friends, sufficient. Talk to them. Next one, please. So how to deal with stress during mental health COVID-19 pandemic? These are 3, 4 slides and then we'll end. Next one, please. Next one, please. So this is the WHO recommendation, psychological first aid. So the World Federation for Mental Health, of which I am the director for the Asia Pacific region, psychological first aid. So what does it mean? Now this applies as doctors when you're dealing with your patients or when you're dealing with a colleague. If you're a doctor or any listen, reflect. The goal is to make initial contact, establish a rapport. Just empathy, empathy. And then assess, are there any psychological symptoms of anxiety, depression, other suicidal thoughts? Make an assessment, sleep disturbance, make an assessment. And then, of course, prioritize what needs to be intervened into. Is it sleep that requires priority? Is it somebody's abusing alcohol? Is it depression and anxiety? So prioritize. And then just like triage in medical, in the ERs, you focus on the severity of cases. And then there are those that may require emergency care amongst your colleagues or even your patients. Next one, please. And then you plan the intervention. whether it's medical or psychological, you talk to other if not abilities, psychological abilities, we must tune them, we must hone them, we must sharpen them to help our colleagues. And step 5 is, of course, what next? Stabilize and in case required, send to a specialist. Next slide, please. Kapil, I can't see the screen.
Can you? You cannot see the screen.
I cannot see the slides on the screen.
Okay.
It will become black actually.
Just a minute, sir.
You have to stop and reshare.
So can you see now?
I can see each one. I can't see the slide.
Oh, no. So now,
let's see
No,
if I
Kapil,
can.
you email me the slides.
Okay.
Your screen is black again.
Just a minute.
When you do slideshow, it goes away.
So just mailed you.
I have not yet got.
I don't know. I seem to have lost the.
Yeah, we can see the slides now.
But I seem to have got disconnected somewhere.
So can you see the slide?
Can you hear me?
Yes, sir, we can hear you.
I don't know where I've lost you. 1 second, let me open Zoom. Here, I can't see the slides.
Kapil, you discontinue screen.
Yeah, 2 more, 3 more forward. Yeah, next one. Next one. Right, so things we can do to support ourselves. Take care of your body. Take deep breaths. Mitali will teach you something. Meditate. Try to eat healthy. Exercise regularly. Get plenty of sleep. Do not use alcohol and drugs. Try to do some other activities for get back to your hobbies. In whatever little time you have between duty shifts, connect with others, talk with people you trust about your concerns and how you're feeling. So something which seems very common sense, but this is what is important. Next slide, please. So build psychological resilience. What is resilience? It is mentally or emotionally snap back from stress. That means emotionally cope with a crisis or to return to pre-crisis situation status quickly. And all of us are resilient to some extent or the other. We need to build on it. And it exists. It is said to exist when people use mental processes and behaviors in promoting personal assets and protecting self from other potential negative effects or stressors. So we need to build our own resources, inner growth, like we went through one of the slides, when you're under pressure, and then cope with it. So in crisis, either one can disintegrate or one can emerge stronger. So to cope, learn those coping behaviors. So adapting well in face of adversity, trauma, tragedy, threats, or significant sources of stress. One can adapt well. So you need to accept it. This is like there was this 84-year-old doctor from Italy who wrote, he wants to get back into looking after his patients. He said, when I signed up for it, now I cannot go back from it. I had signed up for it at the age of 20 when I became a doctor. So mental health needs of healthcare workers providing frontline COVID care. What can be done? So the professional's vital role to look at all the mental states that we have spoken about, and all this can be provided through telehealth service, video visits, mobile apps, online resources, and virtual peer support. So developing a buddy system at office. So probably Dr. Gogia can take us through this, what they have done in their institution. And then to sustain and restore frontline healthcare workers, healthcare organizations, and researchers will need to monitor the mental health outcomes of clinicians and other healthcare workers. That means research into it, what has worked. And that's where I'm going to end this and take it forward into the panel discussion, which means we need to build resilience because that becomes our emotional, personal protective equipment, the emotional kavach, the emotional shield, being flexible inside, inner growth in the face of all the trauma and anxiety that one is facing. And together we can beat COVID-19. Together we can, yes. So let's stay informed and do it. Now we're going to open up to the panel. So Kapil, I'm going to hand it back to you. Yeah.
Yeah. Thank you, sir, for such an excellent presentation on how to deal with the stress during the COVID-19 times. Now, next we have a panel discussion. I'm just sharing the slides for that.
So as for the panel, we are going to discuss, but a small survey was conducted, which Kapil and I worked upon, and we reached more than 450 doctors. Thank you, Wockhardt, for that. So 450 doctors were contacted, and 14 questions were used to present some trends which emerged. The initial trends which have emerged. And then we'll take this up in the panel. We are going to be running a little late. Is that acceptable? I hope so.
Yeah, so that's okay. So can you see the slides now?
Yeah. So so next one, please. So this was a survey. There is a black spot which is appearing on my screen. I don't know what to do with it.
Will you again discontinue? I will share the slides. It is the one what you have shared with me?
Yeah, sir. Yeah, just now.
Because some black spot is coming on your screen.
So this survey looked at about 14 things, whether you're dealing with COVID-19 patients or patients, sort of anxiety, stress. This is from our sample. And a lot of people who are in the audience today would have responded to this. So next slide, please. So this is trend. So since there were no data, so the question was, are you currently treating or have treated COVID-19 patients in your clinic? It's almost 6% were involved in treating COVID-19 patients, whereas 63% were not. So 170 out of the 470 who responded were doing this. And are they worried about exposure contracting COVID-19? Yes, more than 65% doctors were worried about it. And people who were treating COVID-19, the figure was almost 80%, more than 75%. They were worried. Understand it is such a disease. Next one, please. So here it is distress. And have you faced any stigma from society while working in a COVID-19 hospital, clinic, or treating such patients? Almost 40% of the doctors said so. People who are working with COVID-19 directly, more than 50% said they have been facing some stigma from their society. So they were either, people didn't want to meet them, people didn't want to talk to them, or they were troubled in some manner or the other. So stigma is high. Next one, please. Have you experienced any sleep disturbance? Our figures are also more than 40% doctors, and people who are working in COVID units, more than 50% reported sleep disturbance. More than 50%. We gave a Likert scale of 1 to 10. So the mean lay around 5, which means if you looked at, yes, if we put together close to 40%, since it'll be 20% here, 10%, and then 10%, close to 40% felt in some way, prolonged sadness, mood changes of different degrees. 40% people did. And if you look at a figure that almost 80% had, even if you include even mild depression, almost 80% had some sort of sadness or depressive mood change. Next one, please. And did it trigger any suicidal ideas, stigma or stress? We never thought that we would get this figure. In doctors, 20%, a little over 20% reported that they had suicidal ideas. And people working in COVID units, the figure was between 30 and 35%. So more than 30% people, doctors working in COVID units had suicidal ideas. Now this is worrisome, this is alarming, which means the units, the hospitals, the programs dealing with COVID-19 require to have a system in place to help doctors, other healthcare workers who are working in COVID-19 units. And even otherwise, the local medical associations and other authorities need a system that if 20% of all the doctors who were surveyed reported experiencing suicidal ideas. So it makes a lot of sense to invest in mental health. We should be investing in mental health. And that's one of the themes for the upcoming World Mental Health Day, which is going to be on 10th of October. Investing in mental health, access to mental health care, improving access. Investment is required in mental health personally as well as at a policy and government level. So we should take that forward. Next one, please. And most important reasons for stress were thought to be, if you look at it, fear of infection, which is the purple one. And the next was long working hours. And the next was inadequate, isolation and quarantine. So fear of infection, long working hours, isolation and quarantine. And then of course, lack of PPE or other factors came in. We'll share the results with the whole group once the whole data is analyzed. And the next one, please, is the last one. What did people do? Whom did they discuss with? Almost 50% discussed with colleague or family. 20% didn't discuss with anybody. Now, this would be, one would like to actually look at the data and see which one of these were those who had the suicidal thoughts. And 35% said, well, we continued my professional obligation despite what I was experiencing. 30% did consult another doctor. And only about 11% went to a mental health professional. But that is also enlightening that 11% did go to a mental health professional. They did. And yes, religion always comes to the rescue. Within 10 to 15% resorted to religious procedures. And you would see there's no difference between all the doctors or those who are dealing with COVID-19 in terms of figures, not much of a difference. You know, I'm not talking in terms of statistical significance. So this is what we have from our survey. And now we open up with the panel. So Dr. Gogia. And yes. Is Dr. Kler available now or is he not joining?
So he has not picked the call. I called him.
Must, yeah. Since if he's in a procedure like angioplasty or some other procedure going on, then he may not be able to. So maybe start with the panel. So Dr. Gogia, what do you have to say about your experience of having worked and set up a COVID-19 unit, about the challenges that you have faced, about firstly setting up and running the unit, and then of course the things that you may have done to help your whole team and your whole workforce. Is a very large hospital that you have, you know, and what is that you may have done in terms of psychological support and other things, or have
Yes, Sunil, first accept my congratulations for excellent talks. And this talk, actually, I was going through all the processes which we did and the problems we faced while dealing with the pandemic. See, when the unit was established, even we were not conversant with the problems which would come, because it was a new thing, and we didn't know much about the problems, only heard whatever was there in the media and what were the reports from abroad. Initially, it was very difficult for us when we started recruiting the staff and mobilizing the staff from the different areas to COVID zone. See, we made the COVID unit almost within 4 days. We were told
That's
to,
quick. That is really quick.
yeah, for it was only 4 days. Uh, that was the time which was given to us, and the main concern was that the flight from Wuhan was expected, and we had only one unit running that was in RML hospital at that time, and it was mainly the OPD this thing, and there was no ICU. So we were asked to make this so quickly so that the unit is ready before the Wuhan flight reaches. So that was, I think, on 2nd of February, and we were given this task of making this unit on 27th night. But fortunately for us, we had a block which was already ready, but it was not occupied. But we had to put everything in place. We had to equip it. We had to procure the consumables. We had to mobilize the staff. We have to ask for the nurses, the security persons, the MTWs, the workers which are there for ancillary work. So it was quite difficult, and within 4 days we were able to equip the ICU, and it was ready. Initially, we gave only 58 beds for the uh, uh, for the day-to-day management of the patients, and we started with 9-bedded ICU, which was fully equipped with ventilators, with oxygen therapy units, and this thing. So it was quite an exercise at that time, but fortunately we could do it. The other thing was, which you were saying, the convincing people how to react and how to take the precautions. And then there were those fears in all the stages. There was anxiety, there was because we also didn't know much about the illnesses, so it was very difficult for us to explain. And then the technical staff, I faced most of the problems from the technical staff. uh, the people who were posted there, put into the rota, they came up with their problems. Somebody, I'm living alone, or others, they came up, I have small children. Others came up, we are living with older people. So those were the initial problems which we faced. The uh, the postgraduates, the residents, and the senior residents, they were little more understanding, and it was easier to explain to them. But then, why we are being put there? Why not the other half? Then we had to explain that it is a cycle. Then they would be they will come by rotation to these areas. So it was very difficult, and the same thing appeared almost as you have pointed out. Initially, there were these fears, then there was anxiety and depression, they set in. But virtually after, say, about 2 or 3 rotations, then everybody realized that not much of people are getting involved and they will not face much of problem. The slowly the things settled on residents front, and then we also evolved. We made arrangements for their stays in the hotels. We made all of them to stay in the hotels. We gave food from outside. They were not allowed to carry any food inside their own. There was no mixing. The standard precautions were started right from the beginning, and they every batch after every 14 days, the whole batch was explained what to do, what how to handle the situation, what to wear, how to go inside and take the rounds, what is to be noted, and what all. See, these things they know, they already know because they are trained in a specialty of anesthesiologist. But this has to be repeated again and again.
Right. So, but now, what is the human challenge that came up? Because we from our experience as mental health professionals, we view it uh, the human bit that people have come and reported, or the studies have shown. So, did you experience like you said, anxiety, refusal initially, hesitation, and then you help them overcome? But did you experience any more with amongst the healthcare workers, burnout or depression, or were
Initially,
there?
initially there were few problems, and people because the patients were very less to start with, so they were in that block where which was not occupied much. So there were fears that we would be alone in that with one or two patients, and the whole block is new. The staff nurses complained, the residents complained, and obviously at that time there was fear that they will contract the infection. And why me? Why me being posted there? Why not the other one? So those challenges were there, and there was
So,
a lot of stigma at that time also. See, we faced problems. One or two of our postgraduates, they faced problems in the locality where they were staying. The people were saying that you are the ones who are bringing problems in the society. So those things also occurred, but slowly, I think the people also learned, and the doctors also learned, and this
right.
problem was sorted out.
So did any time any people had to take support from the very good department of psychiatry that you have? Uh,
See,
with
most of the times, we, the senior people, acted as psychiatrists.
I think that's something very well said. That
Yes.
if there is mentoring, if there are seniors available, because
Yeah.
that's what you've been referring to,
Yeah.
communication, buddies, seniors, and they're seeing that, well, yeah, if my boss is doing it, and
Yeah.
if there are seniors to guide me, I will sail through. If there's a good captain, there's a good
Absolutely
captain,
true.
the whole team
What
can work.
what they require is assurance and reassurance, and this has to be on regular basis. So we encourage them to talk to us if there is any problem, even if it is not related to medical aspect. The other problems which they were facing, we try to sort it out. So
So it was more also looking at their emotional health, their social support, like
yes,
the unit became like a family. Now, tell me, in this whole period, how did you protect yourself and make sure your team doesn't get it?
yes, you
Because
are
that might be learning for all
pretty
the
right.
2,000
I
doctors
think
who are.
this will vary with people to people. So we are, as a doctor, are very used to our most of the routine, which continued half an hour walk every day that I used to do anyway, and in the evening, if possible, I always do that. And eating in moderation, no smoking, no alcohol, that everybody knows. But these things are to be followed, and then eating healthy food, uh, taking the usual precautions of a mask. If you're wearing mask all the time, others will also do that. Hand washing, we uh, installed the sanitizers everywhere, outside the block, before the entry, in the department, and encourage everybody that you should do this first. Even those our security personals, they were taught that anybody who comes, first hand over the mask, do the hand sanitization, and then you have to enter, and then they were allowed to enter the block. Otherwise, they were not allowed to enter the block. So all those precautions, these things were set up before. And
Fine. So,
and I'm very happy that we have least number of affected health personnel in
right,
the city.
because your infection control
Yeah,
rate is worth noting that the
yeah,
least number and very, very good. Although on the other side, you have very good outcomes, and
Mhm.
at one side, you've been able to control very well. So that
Yes.
speaks a lot for the systems that you have followed. And of course, on a lighter tone, your treatment facility was written about in a magazine or a newspaper, praising the sort of that it was a government hospital, but the sort of luxury to quote, that's what the person wrote, that they were able to get since it was a new block, the food, the clothing, the television, the no newspaper, that could be a fomite,
Mhm.
but people understood, somebody wrote about it, their experience.
Yes, it
So
was actually it was a blessing in disguise for us that the block was ready. Only thing was to equip it with the oxygen therapy units, the oxygen flow meters, the disposables, and all those things. So it was mainly the block was ready. It was empty, and the cleaning, the lighting, the toiletries, all those were ready.
I think all
And
that also brings about a positivity in the atmosphere,
yeah.
even for the healthcare workers. If the facilities are available, toilets are, restrooms are available,
Mhm.
you are getting, like you said, you would get food there.
Mhm.
They were when they had to go in quarantine, the hospital ensured that they would have a place to live in, whether it was a hotel which was
and
converted
and
into
initially
quarantine.
the facilities was single room and double room basis, so there were rooms and there were separate toilets, so it was like isolation. But later on, when the number of cases increased, we had to shift to the ward type of a this thing, which was little more this thing, which was not I was not very pleased about it, because but we had to do it.
So the
There was
numbers
no
were so
other.
high.
We started with 9 beds. Now we have 50 bedded ICU. We have 5 different ICUs running at the same time.
Right.
So
So now, one more question. Since although it's beyond the scope of today's mental health discussion, but since you're an expert and there are doctors here, would you like to, give a very small, keeping the constraint of time in mind, we are out of time. Will you like to tell about the ICU care of COVID-19 patients?
see,
Something small, because that's something which may be of interest to the doctors who are listening, since you're an expert here today.
yeah, uh, uh, it's now what happens? The patient when they are shifted to ICU, most of the times they are already 5 or 6 days has already elapsed since the start of the illnesses. So when they come, they may be having the desaturations. They have the this thing. So already the routine treatment which we give, like azithromycin and vitamin C and those things, have already started. So what we do differently besides the oxygen therapy, which we do, is to do the investigations. Nowadays, it is quite uh, a trend in most of the places to do the D-dimer studies, the CRP levels, the LDH and ferritin levels, and then IL-6 levels. So these are the battery of investigations which we do depending on what stage the patient is. Okay. And when we started initially, we did not have any antiviral therapies also. So, but you realize one thing, that the antiviral therapy has to be instituted right in the beginning, not so up to 7 to 10 days. This should be given if required. Most of the times we put them on steroids, methylprednisolone, which we are using. Dexamethasone is being used by other people right from the beginning when they are in ICU. Then oxygen therapy, we see the saturations, we monitor them. If the saturation they are maintaining with the high flow oxygen therapy, then it's good. If they don't, we switch to NIVs. Our experience with the uh, IPPV has not been very good. The people
Right.
who were put on ventilation, they did not do well. So try to delay it as much as you can,
So
and try the
non-invasive.
non-invasive modes much. The results were much better with the non-invasive modes. Then uh, about the other things like monoclonal antibodies, that is Tosil, the tocilizumab, that we give depending on what is the response, what is the levels of IL-6 and other things, and then we give.
So
So
you.
it also, so now the things have evolved, and we know exactly what thing to use at what time. Okay, so we have used a number of therapies, but most of the times, if everything is okay, there are no associated comorbidities, then patients, they do well, and then they are sent back.
I have two questions now before I move to Mitali. One is that do you think we are going to see a second wave because Delhi is seeing a increasing number? That's one question. And added to that is there, epidemiologists say that it's got to run its course till almost is going to run through the whole country, and 70% or 60, 70% get infected is not going to abate. So from where
We
it
are
came in through
experiencing
global routes.
the second wave. I have no doubts about it. See, initially, if you see the daily pattern, the cases went down to some thing about 600, 700 per day. Now we are seeing the increase again. The latest figures were about 1800 cases. So we are seeing the resurgence, and it is because of the opening up of relaxation in this thing.
So
But
people still need
again,
to follow all the
yes,
precautions they were doing.
again, it has to be stressed again and again that behavioral vaccine, as you called, is more important. There should not be any laxity in this thing. It should not be taken lightly that now the cases have come down, so there should be relaxation in wearing mask, or the sanitization process should go. I think most of the people, they realize this, and I hope the things will be contained.
So you think that is going to be, and what about the vaccine? The second question was related to the Indian vaccine and the Serum Institute trying out the Oxford vaccine, moving to phase 3, and so on. So what is your take on the vaccine?
See, vaccine again, there are lots of reports, and vaccines are being made in almost all part of the world. Everybody is making their own, and they are in different stages of this thing. If you take the process of vaccine making and its effectivity, it takes long time.
Yeah, it is.
See, even the human trials and all those, if not properly done, it will be a half-baked vaccine which will not be acceptable to most of the people. So it will take time.
So even if
And
vaccine comes in, people will be wary of using it because there will be not sufficient data available. That's what I
yes,
mean.
yes,
Thank you.
absolutely.
And
So
thank you for this.
half-baked things should not be put into the market.
So
Once
what
you
is
are sure that
no,
it is giving an antibody response in sufficient quantity, then only it should be introduced.
right. So behavioral vaccine it is till we get the actual vaccine
Yes.
for the virus. And as Dr. Gogia, who's an expert at the COVID, he is the leading person in Delhi in COVID-19, having set up one of the first units and very good outcomes. So as he says that even when the relaxation has been done in the lockdown, we need to still be observant and still be careful. Unless, and of course, one side has been we see patients who were anxious, who, patient, this is not healthcare workers. Somebody said that, well, I've been confined to this 2-bedroom house with 8 family members and 2 dogs and cranky children. Now I need to go out. So, and in that anxiety and hurry, the other anxiety shouldn't set in or the real risk of contracting the virus. So, Mitali, what do you have to say about from behavioral vaccine and from the actual treatment from an expert? What do you have to say about the emotional PPE, which you are fond of calling it, the emotional shield and kavach? And then we go on to your technique. Since we are thoroughly out of time, request you to be brief because your experiential workshop is more awaited.
Okay. Thank you, sir. So I think in your presentation, even in brief, you have very beautifully highlighted the mechanisms that we can use to, like, we can use as an emotional PPE, that is like developing the art of resilience and having the ability for the distress tolerance, and then being able to, like, be mindful of whatever is happening in our surroundings and how to cope up with that in a more positive manner. So one thing is for sure, which which Dr. Gogia sir was also highlighting, that the preparation and the amount of safety measures that we are taking during this pandemic time is of the crucial need. And along with that, the crucial need to take care of ourselves also becomes very important. So first,
so what you're saying is that while we are doing physical sanitization, they require mental sanitization too.
Right. And for that reason, there are, like, since we are running very short of time, so I'll be just putting some very brief tips, and then maybe we can move on to the experiential training part. So again, the first and foremost thing is to understand is acceptance. Whatever it is, the illness or any pandemic does not come after knocking anybody's door. So it is here, it is here. We all have to face it. Worry in no which ways is going to be the solution for it. The more we are going to get worried, the more it is going to lead to the, like, lack of clarity in our thinking and decision making process. So best is to be accepting, developing resilience by taking care of yourself, by making connection with other people, by, like, learning the art of dealing with the negative thought patterns that occur as a part of the worry that is prevailing with this pandemic. Then nurturing a positive view. Obviously, it is the uncertainty kills. But what we are seeing is, if there are death tolls happening, at the same time, there are good recovery rates also. So even with the quarantine at home, lot many people are showing good recovery. So holding a positive attitude, taking good care of your diet, taking good care of sleep. Now, if again we are feeling cooped up into our home while we are working from home, but at the same time, it is the time to nurture our relationships, which all of us have been, like, missing since long time. So again, the ability to increase the distress tolerance. So as sir said, there might be family, like, there are going to be dogs, there are going to be children, crankiness happening, everything. How do we just tolerate the distress? So there are two techniques in very short. One we call as TIP, TIPP, and the other one is accept or improve. So in TIP, we talk about temperature. So again, whenever you are feeling distress because of anxiety, worry, or anything happening in the surrounding, try and change the temperature of your physical system. It could be just getting up, putting a splash on your face, or a splash of water on your face, taking an ice, holding it in your hand, going out of your room, taking, like, changing the, taking deep long breaths in the open air, and maybe doing some deep breathing exercises. Also, some other intense exercises or some kind of muscle relaxation, stretching, like, pulling some sort of physical exercises works best. So temperature, intense exercise, paced breathing, and then deep breathing and paced muscular relaxation. And when we say about the tolerance of in terms of the technique improve, we talk in terms of using the imagery process. I would not accept if anybody would tell me that I don't go into my fantasy world. I don't imagine things, right? So we can use our imagery power to actually imagine positive attributes or positive scenarios or positive aspects that we want to develop in ourselves. Then looking for a meaning in life in whatever is happening right now. Because although quite painful, it is also going to teach us lot many things. maybe a year down the line, we would be glad to say that, yes, we were part of this pandemic and then we have learned so much. Prayer, or like, again, in Indian culture, it holds a lot of value. Even if, like, if I call myself as an atheist, but just taking the name of a supernatural, somebody whom we call a supreme power, feeling that connectedness makes us feel good. Doing relaxation technique. And at the end, I would talk about mindfulness technique. I'm going to give an experiential, a small technique for that. But mindfulness is just about being aware of yourself, your movements, your actions, your thoughts, your emotions in the present moment, irrespective of what is going on around you. And that moment gives you the complete freedom to get associated and the ability to fight the worst that can come in front of you.
So, with this trailer, I think, Mitali, we are all, our appetite has been whetted for your experiential workshop,
So, sir, it's 7:30, going to be 7:30 by my watch. So, how much time we can?
Dr. Kapil, how much time do we have? We are out of time.
Ma'am, around 20 minutes.
Would be sufficient. Yeah. So I would just like everybody to just just sit in a relaxed position and just take. I'll just take a moment, please.
Sure, ma'am. So, doctor, the next session is by Ms. Mitali on experiential based learning. That is mindfulness relaxation.
So while Mitali comes on, so there are only two ways pandemics end. Well, either people develop herd immunity of one type, that your immune system becomes, everybody gets it, or sufficient number of people get it. Or the other way is you get tired of the pandemic and start living your normal life. It's only these two ways that it ends. So we are seeing the latter right now. The herd immunity is yet to build up, but people are going back to their normal lives. But then as Dr. Gogia, what Mitali, and what each one of us says, we should be able to maintain the practices that have helped us survive and come out at the end of this pandemic. And hopefully that in the Indian context, hopefully our national hygiene levels improve.
Yeah. Can we start?
Yeah, yes, ma'am.
Yeah. So I'll be putting on a small music in the background and then I will be continuing. So what everyone just have to do is to sit down comfortably, listen to what I'm going to say and just follow it.
So I'm going to go off camera to be able to hear you and
sure, sir.
shut my eyes and do it.
Sure, sir. Okay. So all of you make yourself comfortably seated. Your back properly supported. Your feet flat on the floor. And I would request you that if any one of you has your mobile phone or laptop in your lap or in the hand, to keep it aside. And just sit in the most relaxed position which you feel is for yourself. And now, I would like you to just select any one point on the wall in front of you, or maybe on the ceiling. And just start staring at it. Just keep on staring at it. And as you stare on that particular point on the ceiling, start focusing on your breath. Feel the breath going in and coming out. Feel the breath going in and coming out as your eyes are on the wall and the focus is on the breath. in a few moments from now on, your eyes might have a tendency to feel tired and heavy. And you would just feel like closing your eyes. So the moment you feel that your eyes are tired, heavy, there are water coming up in your eyes, and you want them to relax, just close them in a gentle manner. Just close down your eyes in a very gentle manner. And now, just take a deep, long breath as much as possible. Hold it for a while and slowly release it. Slowly release it. Once again, a deep, long breath as much as possible. Hold it for a while. Keep holding it for a while and slowly release it. And once for the last time, a deep, long breath. Hold it for a while and slowly release it. And now just start breathing in a very normal manner. Just start breathing in a very normal manner. And with each and every new breath that you are taking, just allow yourself to drift down deeper into a further more deep state, a place where your physical body completely relaxes and your mind is at complete ease and calm. Now, while you do so, there might be thoughts coming up and going into your mind. But just take these thoughts as the clouds coming and vanishing in the sky. So thoughts are coming and they go off. And you keep on enjoying your most natural breath, which has already started filling you up with a lot of positivity within, which has already started to fill you with positivity from within. And as you do so, I would like you to press your index finger with your thumb and keep on focusing on your breath. So press your thumb and index finger in both the hands and start rotating it in a circular manner. Feel the sensation. Feel the sensation that is getting created in both the fingers and the thumb. Whether it is a slight soft feeling, a tingling sensation, or just slightly brushing skin against skin as you circle them together. Now gradually bring your attention to your feet. Focus on your feet nice and deeply and allow them to be connected to the ground wherever they are. Feel connected to the floor and grounded wherever your feet are. As it becomes more apparent, just allow yourself to sink deeper into your chair, noticing the pressure of your back into the chair and chair into your back, feeling completely grounded wherever you are. And as you do that, allow your shoulders and back to relax. Allow yourself to relax. Slowly come back and focus on your breath. Concentrate how you are breathing in and breathing out. Notice that when you concentrate enough you can feel each and every breath going in and coming out. You can feel each and every breath going in and coming out through your heart. Not that it actually goes through your heart, not that it actually goes through your heart, but just feel that your breath is filling your heart with oxygen and giving your body the life. Feel each breath growing through your heart and coming out through your heart. So breathe in and breathe out. As you continue with these nice and deep breathing patterns, you continue to feel that each and every breath is actually passing through your heart. Just listen to my voice to even relax further. This is known as heart activation breathing method because it simply allows our heart to get activated. Heart is the place where the truth is. Heart is the place where the love and compassion comes from. As we activate these areas and we combine them with the mind, it gives us a greater power to be clear and to have truth in our lives. In times of stress, anger, frustration, depression, or feeling upset, even having any unhelpful negative emotions, these patterns gets completely misaligned. And these patterns are nothing but electrical pulses coming from the heart and going through the mind, so they get completely misaligned. By just doing this exercise for 3 minutes, you can allow this misalignment to vanish and create a complete alignment of your mind and body, which will activate the love, compassion, truth, and clarity which we all look forward to. So just for the moment, I am going to be silent, but I would like you to focus on your breathing. And as you would breathe, breathe each and every inhalation actually passing through your heart, prevailing in your overall bodily systems. And then as you breathe out, you feel that all negativity is moving out and your heart and body are getting aligned. If your thoughts wander off, it's perfectly okay. Just bring them back to focus on your breathing. Just bring them back to focus on your breathing. Accept that it happens and it's fine. Congratulate yourself to actually being able to catch your thoughts and then being able to let them go away. And congratulate to being able to focus on your deep breaths going in and coming out. And as you do so, I would like you now to consider 3 things in your life that you are grateful for. So consider first thing, the very first thing that you are grateful for your life in this moment. What could be that very first thing? It doesn't have to be something big. It can be something small, something very massive, and it's absolutely your choice. It could be as simple as waking up fresh in this morning, or the first water that you had to drink, or getting a wonderful cup of tea from your spouse. The choice is yours. So consider that what's first thing you are grateful for right now, and take a few moments to focus on whatever it is, being completely grateful for it right now. And then what's the second thing that you are grateful for? Focus on that. Focus on that and feel grateful. Take few moments, and as you feel grateful, feel that gratefulness all around from the top of your bodily system, which is called as brain, which is the abode of our mind, and prevailing till your feet. You're feeling so grateful right now. And now, the third thing, and the last thing which you feel grateful in your life right now, thinking about which gives you happiness. Thinking about which gives you pleasure. Even just imagining about it makes you feel happy. So be grateful, be thankful, and just focus on that gratefulness for another few moments. Just feel it as I remain silent for another few seconds. I would like to count from 1 to 3, and I would like you to imagine something. Just please close your eyes and imagine that it is a very beautiful day. It's a very beautiful day, and you have gone to a beach. You have gone to a sea beach. Huge sea with waves of water coming and going. It's a very beautiful place. Serenity is there all around, and the weather is absolutely nice. You can see the clouds in the sky. The cool breeze is blowing, and in one of your best dresses, you are walking barefootedly on the sand, the seashore. As you walk, you can hear the sound of the waves. You can feel the soft sand beneath your feet. Beneath your feet. It's so soft, so soothing. You keep on walking, enjoying the blessings of the nature. And as you walk, the waves of water come and touch your feet. The moment that they touch your feet, you feel a very pleasant sensation from inside. You are feeling really happy, really calm. Look at your own face. It's so calm. It's serene. You feel so healthy and happy from within. The serenity that you have always wanted for yourself. You look at others at a distance, playing, laughing, giggling, giving you the glimpse of a happy world. The me moment that all of us have been looking forward to in this time. And somewhere from the distance, a beautiful music is being heard, further increasing your positivity, your calmness, your contentment, as the sprinkles of water come up on your body, on your face, further enhancing the pleasantness deep inside in the body and the mind. You feel so very calm, comfortable, and relaxed with your own self, focusing on each and every sensation, each and every sight, each and every beautiful is smell that you might be getting from the surrounding, the sensations, the sound. Maybe you can watch, you have a favorite fruit in your hand, and the moment you take the bite, you take the bite completely into your mouth, and the moment the juice goes, the feel that you get with it, it's immensely satisfying. You can feel it into your mouth. You can feel it into your throat. You feel happy. This sort of situation is immensely satisfying. So you're enjoying one way, relishing your fruit, and one way playing with the waves of water. Or maybe just moving around, feeling the soothing sand beneath your feet. Your whole body and mind are deeply relaxed, totally calm, contented, full of positive light and energy. And I'll be counting from 20 down to 0, and this feeling of positivity will become a deep integral part of you, even when you will come out of this deep relaxed state. So 20, the moment I'll be saying 0, this will become a deep integral part of you. 19, 18, 15, 16, 17, coming up, feeling more and more lighter, more and more calm, more and more contented. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. A deep, long breath by everyone. So have a very nice deep breath passing through your heart, making the alignment perfect. And as we come to the end of HAB, the Heart Activation Breathing Experience, hope you enjoyed. I would like you to gradually open your eyes, come back into the room where you are. And now notice 2 things in the room which you have either never noticed before or not noticed for a while. And maybe just one more thing which you haven't noticed or not noticed for a long time. Rub your palms against each other as much as possible so that you can feel the warmth in your hand. And now put it on your eyes. So thanks for participating. Thanks for enjoying, for the immersing and being involved. Thank you.
Thank you, ma'am, for such an, sir, please. Yes, sir, please. Thank you, ma'am, for such an excellent session. I hope everybody is feeling relaxed and more refreshed now. And maybe they can practice this at home also, matlab, at the convenient times.
Definitely. Yeah.
Dear doctors, on the behalf of Wockhardt, sir, Mittal sir, any final comments from your side?
If Dr. Gogia wants to make any comments.
Gogia sir, any final comments from your side?
Yeah, thank you so much. It was really very, very good. And Mitali, your voice is very sedating. So it's a hypnotic voice. So very relaxing. Thank you so much.
Thank you,
Thank you,
sir.
sir.
So, uh, doctors, on the behalf of Wockhardt, I would like to thank all the delegates who have attended this important webinar on mental health. And I would also like to thank all the esteemed faculty members. First, Dr. Mittal sir, for sharing the whole concept of mental well-being during COVID times. What are the things which can be done? And Dr. Gogia sir, for telling us about the ICU setup and telling us about the needs and requirement of frontline healthcare workers. And Mitali ma'am, for such an excellent session. I hope everybody has enjoyed this session. I think this topic was the need of the hour. All the healthcare workers are somewhere or the other are exposed to COVID. So dealing with the mental health of healthcare workers is really important. And I think all the faculty members have excellently covered in this symposium. Thank you all for your presence. Thank you, sir.
Thank you.
Thank you. Thank you, sir.
Thank you.
Thank you.
Thank you, everyone. Thank you.